My name is Somali Tath. I am the Employee Services Coordinator at Gramercy Court. So in this role, I have lots of responsibilities. I am the receptionist, in which I answers and direct phone calls. I greet all visitors that come into the facility. I answer any questions that they may have and direct them where they want to be. I'm also the accounts payable coordinator, in which attention to details is the key. I process all invoices for the facility. I make sure I get them approved by both the administrator and department heads. And once that's completed, I submit it to accounts payable for final approval. And then I also do the payroll coordinator, in which I process all TARFs, missed punches, vacation sick hours for all employees, so employees can be paid timely. And then I also do other miscellaneous stuff, like the 3.2 DNSA audit, and I distribute benefits to employees once they become eligible. Each day I do make a difference. I make sure that anybody who walks into the building, I greet them with a smile. I give them a simple good morning, hello, because a simple gesture like this can brighten someone's day. I try to answer any questions they may have. And if I cannot answer their questions, I will redirect them to someone who may answer their question or know the answer to their questions, and just try my best. Well, the person who inspires me is my dad. He works hard, so that's why he works hard, so that makes me work hard, because he has 6 children. He supports all of us. So with my dad working that hard, that's how I am who I am today. And then, of course, I do want to thank Generations Healthcare for acquiring Gramercy Court. I want to thank my team, Dan Bushnell, the administrator, Debbie Graham, my supervisor, and all my co-workers for this presidential award. I am thankful, appreciate what I am receiving. I love what I do, and I thank each and everyone for this.
My name is Rosary Reyes. I am a charge nurse and weekend supervisor at Pleasanton Nursing and Rehabilitation Center. I provide quality patient care and services in the short stay unit, and I make sure that our patients experiencing a good experience in our facility. And I do everyday rounds to make sure my patients are comfortable and they all meet their daily needs. Our mission statement is very close to my heart. When I chose this profession and during my nursing studies, we taught how to give care, show kindness and compassion to our patients. For that, the mission statement is very important to my job. I had a patient who had a left hip replacement surgery. She was in a lot of pain and feeling hopeless. I reassured her, I encouraged her that she will be taken care of. Every day I assess her, I make it sure that she is comfortable. After a few weeks, she can walk again. And she has a big smile on her face. She and her family are very thankful for the care provided. In fact, our patients send us cards, flowers, and even they visit us just to say hi to everyone. I want to thank my husband for always being supportive. I'd like to thank our administrator and Ms. Kendra Noonan and my director of nursing. Mary Ann Kegel for always here for us, for their support and guidance and encouragement.
My name is Emma Santiago, Certified Nursing Assistant from St. Francis Heights, and I've been working in this company for 13 years. I used to provide care for my residents, a good quality care, and I assist them also in their activities of daily living, such as feeding, bathing, dressing, and I always answer their lights to attend their needs. And I also responsible for checking their changes of condition. So if there's any changes, I'm just gonna report it to my charge nurse. I had a patient and unfortunately she came back after a year, and the family together with the patient, they requested me to be their CNA because they said they want my quality of care to the resident, and they said that I always give a smile on the patient, so it helps a lot. And I'm so proud of myself that time because they acknowledge my hard work. The mission statement is always in my mind. I always say to it that whoever enters the generation home will be met with kindness, competence, and compassion. So whenever I have a patient, I treat them with love and care, and I treat them as my family. So I am looking forward to make their life be a positive one, so they will be happy in our place. So that's what I leave the mission statement. I would like to thank the management, of course, for giving me this presidential award. I feel so blessed and honored for giving me the opportunity to be part of the company. And in return, I will be loyal to Generation.
My name is Hilda Mulligan. I'm a registered nurse, and I'm working as a morning supervisor here at Vista Manor. I see to it that everything goes smoothly and well in the unit. So I instruct, oversee, and direct the staff, the team member, how to best care for our patient. So I discuss with the doctor, family members, as well as the patient and interdisciplinary team member. Should there be a change of condition and what will be the best care of plan for our patients. So I ensure that the needs of our patients are met. And should they need to be followed up by an orthopedic, infectious disease doctor, cardiologist, so I make those appointments. Not only I focused on the patients, I also focused on the need of our staff because they are the integral role for our patient needs. I stop from my work and do my rounds, and is there something that I can do for them or I can be of any help? Or simple things like, for example, for those who are high risk for fall, I relieve them from that if they're in the busiest time of the shift. So I place those fall risk patients within my vicinity and close supervision. So on top of that, I also do admission, discharge, and also fill in as a treatment nurse and also work as a floor nurse, a bedside nursing if need arise. The one that really made impact with me, aside from all the team, the interdisciplinary, team members, because we work as a team. We are not monogenetic. We are synergy. We work as a team. Is our administrators. Because with our mission statement, I see that our mission statement is the root of the tree, and the trunk is our head departments, and the branches are our employees. So I see in them, they reflect our mission statement, and I'm in awe and very inspired of what they do because they're very composed, they're very compassionate, kind, and all of that. So, yeah.
My name is Jenny Guillermo. I'm Director of Nursing at Plumtree Care Center. I've been with Generations for 5 years. My major responsibilities here are making sure that we're delivering the best possible care to our patients, and that with our interdisciplinary team, that's where our focus is, and making sure that also all of our staff are delivering the care to the patients, and that they're holding the same high standards as we do on the IDT team, and they live that mission statement with us. How I try to live the mission statement every day is I come to work and really try to treat everybody as if they're your own, with that, the kindness, the compassionate energy, and also within our team, our IDT team and our staff, our line staff. I think that Ian and I had worked really hard this last year to protect that and to build our team even more around the mission statement. And it's been amazing. We have a great team, and it trickles down and resonates to all of our staff. And you can tell, in the patients and in the families, everybody, for the most part, everybody is just so happy. And our job is to make sure that in these times when it's some of their hardest times in life, is to make that part easier, as easy as it can be and as smooth as it can be for their transition, to get home. So the people who have had the biggest impact and influence in my life has definitely been my parents. I've been very fortunate to have the both of them, and they have always been such a positive influence and force in my life. For as long as I can remember, all I've heard from both of them was, no matter what you choose to do in life, you will 100% have our support. And that does so much to somebody that's growing up as a child, to high school, to college, into your career, to have that feeling behind you with your parents. It's almost like it gives you this sense of fearlessness that you can do whatever or pursue whatever you want to, because you can't disappoint anybody. They're gonna support you no matter what. And I am who I am today definitely because of them, and they have just been a huge support, and I am my parents, and they've been nothing but wonderful in my whole life. So.
My name is Catherine Aburto. I'm a social services assistant, and I work in Generations Healthcare for 5 years. One of my daily responsibilities at this facility is to visit my patients every day. I make sure my patients under hospice care, I provide support to them, and I monitor any changes in behavior and mood and report it appropriately. I also assist my social services director in discharge planning. I make sure the residents go back home safely, and I provide support throughout the discharge. I also make sure my patients, long-term care patients, receive all the ancillary services such as podiatry care, dental care, audiology care, and optometry. I feel like I'm made a difference by working as a team player. No matter the situation, I'm always there for my coworkers and my residents. I'm not only advocate for my residents, but I support my coworkers as well. No matter the situation, it doesn't matter if it's not social services related, I'm always there for them. I try to live the mission statement by providing good care to my patients, by treating my patients with dignity, compassion, and kindness, and not only to them, also their families. And I try to provide the best care, and I also empathize with them. I try to help them, support them, and provide the best quality of care to them. My social worker, Lydia Rangel, she is a good example to me. She taught me everything to be able to work with residents, and I'm very happy with her. I owe her a lot because she made me another person, a better person now, and I'm able to work with my residents. I just want to give a special thanks to my administrator, Tracy Murray, because she's been very supportive of me. She even encouraged me to continue my education and become a registered nurse. And I'm glad that I'm here, and I thank her for the opportunity that she provided to me.
My name is Roseanne Belen. I'm an LVN from St. Francis Pavilion. I've worked here for almost 6 years now. My daily responsibilities are wound treatments, MedPass, and a clinical coordinator. For the mission statement, the most important one is like caring for me, most likely. Being in a facility like this, it reminds me of my grandparents, to be honest. It's like taking care of them, even though they're far away. So being able to take care of someone else, like someone else's mom, dad, or grandparents, it's like, it reminds me of that. It makes me feel like I'm at home. One of the things that made an impact to me was working with this one resident. She had a wound, which I worked for a very long time. Seeing her every day, telling me that she's very thankful for me, like taking care of her, making sure the wound is getting better, that made a very big impact to me. Like, it's very touching to see how a patient can be like thankful for like just taking care of them. So for me, I've worked with her here just like for like a year or more. It's actually, I call her Ate. It's Ate Malen. She's been my she inspired me to do more and beyond. So she's been teaching me. I'm actually her assistant clinical coordinator. She's helped me with like most of my job here when she started here. So yeah, she is like my big sister here. She's helped me with problems. She's there when I needed her. I want to thank my administrator, Tim, of course, for giving me this opportunity to be the presidential awardee. My DON, MJ, for being there for me, and all the nursing staff that's been here ever since I've worked here. Ate Vicky, which is my second mentor of all, she's been with me for 5 years now. And my parents and everyone who works in Pavilion, most likely.
Hello, my name is Renu Narayan. My title is Central Supply Manager. I work for English Oaks, and I've been here at English Oaks for 31 years. My job responsibilities is to provide for my nurses and my customers, which I get to spend money. So I deal with lots of vendors, get the best price and a quality product for my residents and my patients here at English Oaks. And I also keep track of all the equipment that gets delivered to Central Supply. And also I have a very tight inventory system that is great, and it works great for English Oaks and me. Providing a service to my residents, it's always with a smile. And, my main thing is provide all the medical supplies they need. And, I'm a 100% team player. If someone's needing a help, I'm walking down the hallway, Renu, can you help me get me a towel? Of course I can, I'll grab a towel and I'll run it to that CNA or a nurse or family member. And not too long ago, we had a patient, she had a halo and it was padded with all the sheepskin. And poor lady, she ate food and it got dripped on her sheepskin. So it was kind of dirty, sitting in the hallway. So I took her in the room and I washed it with soap and water, got a blow dryer and dried the sheepskin so she's not wet or cold. And things like that, it really touches my heart. And of course my patients are the number one, and that's why I'm here at English Oaks, to provide. And I'm a very hardcore believer in my mission statement. I feel it, I live it, and I've been doing it for 30 plus years. And first of all, I would like to thank my God for supporting me and guiding me. I thank my parents in heaven for who I am today. And I thank Mr. Olds, Mr. Black, and Mr. Boyd for allowing me to work for this Generations family. I'm very proud to be here. I thank Deanna Hill, my administrator, Kelly Dykstra, my supervisor. They've been my role model. Without them, I wouldn't be at English Oaks for 30 plus years. They've been there for my happy days, they've been here for my sad days. I really admire. And I thank my English Oaks family in general. I love my family here at English Oaks, and God bless them.